Autoimmune diseases are a group of conditions where the body's immune system mistakenly attacks its own healthy cells and tissues. Your immune system is designed to protect your body from harmful invaders like bacteria and viruses. Normally, the immune system can distinguish between what belongs in the body and what is foreign. However, in autoimmune diseases, this self recognition process goes wrong, leading to inflammation, tissue damage, and dysfunction of affected organs. Autoimmune diseases can target various parts of the body, including the skin, joints, muscles, blood vessels, and even major organs like the brain, heart, and kidneys. There are more than 80 known autoimmune diseases, and they vary greatly in severity and impact. Some autoimmune diseases affect a specific organ, while others have widespread effects throughout the body. According to research, nearly 80% of all autoimmune disease patients are female. The exact reason for this gender disparity is still under research, but hormonal and genetic factors are believed to play a role. Types of autoimmune diseases. Autoimmune diseases are diverse, but some are more common or well known. Here are the main types. Number 1. Rheumatoid arthritis. This stands as one of the most common autoimmune conditions, primarily affecting the joints. In this condition, the immune system attacks the synovium, the soft tissue lining your joints, leading to painful inflammation and eventual joint deformity if left untreated. The condition typically starts in smaller joints like fingers and toes, gradually progressing to larger joints and can even affect organs in some cases. Number 2. Type 1 diabetes. Type 1 diabetes occurs when the immune system destroys insulin-producing cells in the pancreas. Without insulin, your body can't properly regulate blood sugar levels, leading to potentially dangerous complications. This form of diabetes typically develops in childhood or early adulthood, though it can appear at any age and requires lifelong management through insulin replacement. Number 3. Lupus. Also known as systemic lupus erythematosus, lupus is a more comprehensive autoimmune disease that can affect multiple body systems simultaneously. So, it can target various organs, including your skin, joints, kidneys, brain, and heart. One of its distinctive features is the butterfly-shaped rash that often appears across the nose and cheeks, though not all patients develop this symptom. Number 4. Multiple sclerosis. This involves the immune system attacking the protective covering of nerve fibers, called myelin, disrupting communication between your brain and the rest of your body. This interference can lead to a wide range of neurological symptoms, from difficulty walking to problems with vision and balance. The disease can progress differently in each person, with some experiencing mild symptoms and others facing more severe disability. Number 5. Psoriasis. Psoriasis occurs when your immune system accelerates skin cell growth, causing cells to build up rapidly on the surface of your skin. This results in thick, scaly patches that can be itchy and painful. While primarily a skin condition, psoriasis can also affect joints in some cases, leading to psoriatic arthritis. Number 6. IBD. Inflammatory bowel disease, including Crohn's disease and ulcerative colitis, occurs when the immune system attacks the digestive tract. This can lead to chronic inflammation, causing symptoms like severe diarrhea, abdominal pain, and weight loss. These conditions can significantly impact quality of life and may require long-term management strategies. Symptoms of autoimmune diseases. The symptoms of autoimmune diseases can be as varied as the conditions themselves. In rheumatoid arthritis, the most noticeable symptoms start in the joints. People typically experience severe pain and stiffness, particularly in the morning or after long periods of inactivity. The pain usually begins in smaller joints like fingers and toes, appearing on both sides of the body symmetrically. If one wrist is affected, the other typically is too. Joints become swollen, warm to the touch, and tender. Over time, the constant inflammation can lead to joint deformity if left untreated. Beyond joint symptoms, people often experience fatigue, low-grade fever, and loss of appetite. Some might develop rheumatoid nodules, which are firm bumps under the skin near affected joints. In type 1 diabetes, the symptoms typically develop quickly and can be severe. People experience constant thirst that seems unquenchable, leading to frequent urination, even during the night. Despite eating normally or even more than usual, unexplained weight loss occurs. Fatigue becomes overwhelming, and people might notice blurred vision. In advanced cases, people might experience nausea, vomiting, and stomach pain. Lupus presents with a distinctive array of symptoms that can affect multiple body systems. The hallmark sign is a butterfly-shaped rash across the cheeks and nose, though not everyone develops this. People with lupus often experience extreme fatigue that doesn't improve with rest, fever, and joint pain that moves from one joint to another. Skin problems are common, with many developing rashes that worsen with sun exposure. Hair loss often occurs, and some people develop mouth sores. Internal organ involvement can cause chest pain when breathing deeply, kidney problems leading to swelling in the legs, and cognitive issues, often described as lupus fog. Multiple sclerosis symptoms vary significantly among individuals, but often start with vision problems, including blurred or double vision, or even temporary blindness in one eye. Many experience numbness or tingling in their limbs, which can progress to muscle weakness or spasms. Balance problems and coordination difficulties become noticeable, making walking challenging. Fatigue in multiple sclerosis is particularly debilitating, often described as an overwhelming exhaustion that interferes with daily activities. For those with psoriasis, the primary symptom appears on the skin as thick red patches covered with silvery scales. These patches, called plaques, most commonly appear on elbows, knees, scalp, and lower back, but can occur anywhere. They often itch intensely or feel painful, and can crack and bleed. When psoriatic arthritis develops, people experience joint pain and stiffness along with the skin symptoms. The joints might become swollen and warm to the touch, and morning stiffness is common. Inflammatory bowel disease, including Crohn's disease and ulcerative colitis, primarily affects the digestive system. So, people experience severe abdominal pain and cramping, often accompanied by persistent diarrhea that may contain blood. Weight loss occurs due to poor nutrient absorption and reduced appetite. Fatigue is common, and many experience urgency to use the bathroom, making it difficult to maintain normal daily activities. Some people develop fever, night sweats, and inflammation in other parts of the body, including joints and eyes. It's important to note here that these symptoms often follow a pattern of flares and remissions across all autoimmune conditions. During flares, symptoms become more severe and new symptoms might appear. These flares can be triggered by various factors, including stress, certain foods, lack of sleep, or environmental factors. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of autoimmune diseases. The exact triggers of autoimmune diseases remain somewhat mysterious, but researchers have identified several factors that likely contribute to their development. Genetic predisposition plays a significant role, as these conditions often run in families. However, having a genetic predisposition doesn't guarantee you'll develop an autoimmune disease. Environmental factors typically need to interact with these genes to trigger the condition. Certain infections, toxins, and pollutants are known to trigger autoimmune responses in genetically predisposed individuals. Viral infections such as Epstein-Barr virus have been linked to diseases like lupus and multiple sclerosis. Exposure to harmful chemicals or prolonged stress can also influence immune system behavior. Hormonal changes can influence autoimmune disease development, which helps explain why many of these conditions are more common in women, particularly during childbearing years. Some autoimmune diseases might be triggered by major hormonal changes, such as those occurring during pregnancy or menopause. Diagnosis of autoimmune diseases. Diagnosing autoimmune diseases can be challenging because many symptoms overlap with other conditions. Blood tests play a crucial role in diagnosis. These might include tests for specific antibodies associated with certain autoimmune diseases, as well as markers of inflammation like C-reactive protein and erythrocyte sedimentation rate. Some conditions require specific tests, for example, anti-CCP antibodies for rheumatoid arthritis or anti-nuclear antibodies for lupus. Imaging studies such as X-rays, MRI, or CT scans might be necessary to assess organ involvement or damage. In some cases, tissue biopsies might be required to confirm a diagnosis or evaluate the extent of tissue damage. Treatment for autoimmune diseases. Treatment for autoimmune diseases typically focuses on managing symptoms and preventing organ damage. Here are the main approaches currently available. Number 1. Immunosuppressive medications. These drugs work by suppressing the overactive immune response. Medications like methotrexate, azathioprine, and cyclophosphamide can be effective, but require careful monitoring due to potential side effects. These medications work by reducing inflammation and preventing further tissue damage, though they can increase susceptibility to infections. Number 2. Biologics. These newer treatments, including drugs like TNF inhibitors and rituximab, target specific components of the immune response. They're often more precise than traditional immunosuppressants and can be highly effective for conditions like rheumatoid arthritis and psoriasis. These medications are typically administered through injection or infusion and require regular monitoring. Number 3. Corticosteroids. Drugs like prednisone can quickly reduce inflammation and provide relief during severe flares. While effective in the short term, long-term use can lead to significant side effects, so doctors typically try to use the lowest effective dose for the shortest possible time. They're often used as a bridge until other treatments begin working. Number 4. Symptom-specific treatments. These might include pain medications, anti-inflammatory drugs, or treatments targeting specific organs affected by the disease. For instance, insulin therapy for type 1 diabetes or anti-seizure medications for certain neurological symptoms in multiple sclerosis. These treatments don't address the underlying immune system malfunction, but help manage its effects. Number 5. Lifestyle modifications. A healthy diet, regular exercise, stress management, and adequate sleep can significantly impact symptom management. Some people find that certain foods trigger flares, so keeping a food diary can be helpful. Regular exercise, when appropriate, can help maintain joint flexibility and overall health. At the end, living with an autoimmune disease requires a comprehensive approach to treatment and often involves working with multiple healthcare providers. The goal is to find the right combination of treatments that effectively manages symptoms while minimizing side effects. Now, we want to hear from you. Have you or someone you know been affected by an autoimmune disease? What has been the biggest challenge in managing it, and what tips would you share with others going through the same journey? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.